So, so if you don't want to be seen or whatever, you can just turn your camera off. If you're going to ask a question, you could do that in the chat if you don't want to come on camera when we get to that point. But it's only going to go out to like our people. It's not going to be like posted like all over the internet. Not that people would find it interesting enough to share. Um, um, and we have one of our friends joining us, Kevin Brennan, who is not quite here yet. Um, so we'll give him a minute. Meanwhile, why don't I just tell you guys about something interesting and exciting that will be coming out with it probably after the 4th of July, which is that PLF commissioned a new survey on C. diff awareness in the United States. So it's the first survey in 5 years. And the positive headline is that it seems like awareness has increased by about 6%. So it was that 60% of Americans had never heard of C. diff at all, and now that's down to 54%. So we're working on a report, having gone through like all the demographics and trying to see if there's any trends, like, do people in certain states, are they more knowledgeable? People with with a degree, things like that. So, so we're going through all of that, and we hope to have that out probably mid-July. And we're going to make a very big fuss about it in the media, and hopefully the media will pay attention to it. It's very hard to break through the media these days. But we will nevertheless endeavor to try. So, all right. Why don't we go ahead and get started? Because I do want to be sensitive about people's time. So, I'm sure folks are aware that there's been a lot of talk and wheeling and dealing around two things. One is what is referred to as one big beautiful bill, which is a budget reconciliation bill that would have long-term impacts, probably up to 10 years. There's a ton of stuff in it. We're not going to get to cover all of it. And then there's also the 2026 federal appropriations, so the federal government spending for 2026. Both of them have concerning cuts to programs that people with C. diff really rely on. And so that's what we're going to go through. We want to make it very tangible for everybody. We want to make it very understandable. Jamie, we could do the next slide. So I think most of you know who I am. I'm Christian John Lillis. I'm the co-founder and CEO of the Peggy Lillis Foundation. Just briefly talk about what C. diff infections are. I think almost everyone on this phone call has intimate knowledge about it. But it is a gram-negative bacteria that causes diarrhea and colitis. It may also cause severe abdominal pain and lead to sepsis and toxic megacolon. Most people, as we know, get this infection when their microbiome is disrupted, often because of antibiotics, though not exclusively. And it is one of the most common healthcare-associated infections. It's important because every one of you is important, and you've all battled this or had a loved one battle it or have patients that battle it. So you're intimately familiar with just what a devastating illness this is. The estimates are have about 500,000 infections every year. About 180 to 200,000 of those are recurrent infections, and about 30,000 of them prove fatal. So what does it have to do with public funding or federal funding for public health? So innovation in the prevention and treatment of C. diff has relied and continues to rely heavily on public funding, as do the mechanisms to surveil, track, and report on C. diff cases. So just over the past 5 years, public investment in C. diff prevention and treatment. So this is just money given in the form of grants, or in the form of loans or what they call push and pull incentives. Over 100 million of that has been given to biotech companies, universities, medical centers to study C. diff. And also the National Healthcare Safety Network, which tracks and reports on C. diff and other HIs, is run through the Centers for Disease Control, and it has its own little line item. Jamie, do you want to go to the next one? So I find this particular slide to be very interesting. I think we might try to make like a infographic out of it. But basically, C. diff, the bacteria, was first found in the stool of neonates. And as you may know, healthy children are born, and a significant percentage of them have C. diff in their stool for the first 6 months to 18 months. It is not dangerous to them. We think they may not have the receptors in their bodies. And then C. diff in 1978 was identified as a cause of colitis following clindamycin use. And I'm sure many of you are probably gnashing your teeth at clindamycin, as I always am. And from then until about the mid 2000s, it was more or less considered a nuisance disease. It was not nearly as fatal as it is today. People didn't suffer occurrences the way they do today. But in 2005, a new hypervirulent and more deadly strain, the NAP1 strain, started breaking out in North America, in Canada in particular, and also in the US, and then somewhat thereafter in England. So the NAP1 strain, so NAP stands for North American Pulse, which is one of the ways that they were able to study it. And that's when we begin to see, the number of people dying from C. diff every year increases greatly. And then in 2010, my mother, who I often think is the canary in the coal mine, she dies from a community-acquired C. diff infection, which inspires us to start the Peggy Lillis Foundation. The next year, fidaxomicin, the first ever C. diff-specific narrow-spectrum antibiotic, is approved by the FDA. In 2012, Open Biome is founded, which makes FMT more accessible. 2013, FDA permits FMT to be used as a treatment of last resort. And then we have, no milestones, but there's a ton of progress. There's all kinds of research and clinical trials going on, which leads us to have Reabiota, the first live microbiome therapeutic approved by the FDA, followed the next year by VOWST. And right now there are several other treatments that are working their way through the pipeline. So this is what I said when I said I want to make it, really tangible. So pharmaceutical companies, and we work with many of them, as I suspect you all know, they exist to make profits. And so they tend towards drugs and research that looks likely to make a profit. And technically, C. diff, because there's around recurrent C. diff rather, because there's around 200,000 cases a year, is considered a rare or orphan disease. C. diff itself isn't, but recurrent C. diff is. And, something like this, these kind of diseases are often more reliant on federal funding to reach approval because, the big private investors, they want to fund the next Lipitor, the next Ozempic. They want to get a big return on their investment. And the government doesn't have to make a return on its investment. And usually what happens is, like, when we have the funding that comes from the government, we will see private money follow that initial investment. So let me give you 3 quick, very specific, excuse me. It's very hot in New York today. I'm trying to keep the AC down so it's not so loud in the background. That I did just kick back on. So Just to give you a couple of examples, so BARDA, which is a subdivision of the Department of Defense, and so they fund things that they consider to be a potential national security risk or a risk to like troop readiness. And they do consider C. diff to be one of those things. So they gave $62.4 million to Summit Therapeutics to develop ridinilazole, which is a C-specific antibiotic very similar to fidaxomicin, though slightly even fewer recurrences than fidaxomicin. And unfortunately, and I won't go into the deep annals of history here, but unfortunately, ridinidazole has not yet been approved. It's still out there, it still exists, people own the rights to it, but the FDA basically they did a trial. The trial looked good in terms of recurrences, but not the initial cure rates weren't that much better than vancomycin. So the FDA wanted them to redo the trial, and they didn't have the money to redo the trial, and they couldn't find investors to fund another trial. So it's sitting somewhere, and we don't have it because of that. More recently, Vedanta Biosciences, they received almost $24 million from BARDA for the phase 3 trial of VE303. So if you're familiar with Rebound or VOWST, so these are microbiome drugs, live biotherapeutic products. Both VOWST and Rebound require donors. Basically people to give stool, and they have to have stool banks to create the drugs. So the difference with VE303 is that it will not require donors. It's developed purely in the lab. It's been very promising so far, but again, as you can see, that's quite a bit of money that they've gotten from the federal government. And then Crestone, which just completed its phase 2 trial. Now this is for a new antibiotic similar to ridinilazole, that just targets C. diff. It's very specific. Their phase 2 trial is very promising. They are now trying to raise money for their phase 3 trial. And just to give you a sense, doing a phase 3 clinical trial can cost anywhere from $50 to $100 million. So, and that's because we want to have we want to get several hundred people to take the drug. We want to make sure it's safe and effective. There's a lot of scientists involved, and you need a lot of sites involved. You need to recruit those sites. So it's quite a big undertaking. So those are just 3 examples. We could certainly give you more. The other thing that I would say is when it comes to something like Rebound or VOWST, that we don't have specific funding for them that I can point to. Over the past 15 years, there's been a ton of public investment in studying fecal microbiota transplant in general. Tons of trials at hospitals and through the Veterans Affairs Administration. And while none of those actually sort of came to that drug, that knowledge and that publicly funded research certainly aided those companies. So the other thing that there's a lot of public funding for that I want us to understand is actually understanding C. diff. So, the more we study this disease and this bacteria, the more we learn about it. So just to give you a few quick examples, just recently, 6.5 million went to the Oklahoma University College of Medicine to study the viability of a C. diff vaccine. 1.2 million went to study mRNA suppression of C. diff. So you guys have probably heard mRNA around the COVID vaccines. Some of those are mRNA vaccines. The 2 most common ones were. So looking at that as well. And then something that's also critically important is that the American Gastroenterological Association, or the AGA, they run as far as I know, somebody has to mute themselves. Thank you. So I guess maybe 6 years ago, they started a fecal microbiota transplant registry. So doctors and patients can add themselves to the registry, and then they basically follow up every so often to make sure that it worked, the person's still healthy, the person hasn't had a recurrence. If they have, they note that. Um, and now that we have these live live biotherapeutic products, you can tell at the end of the day. Those are also potentially included in the FMT registry. And that is the goal here is to understand over long periods of time, we could eventually do like longitudinal studies and see like, did people who got standard FMT have changes to their microbiome that we didn't fully appreciate? Do the drugs operate differently? Like it's really important. So next slide, please. So changing tact a little bit, what I want to talk about now is the federal tracking and surveillance. So when I talked earlier about the NHSN, National Healthcare Safety Network, so the vast majority of infection surveillance and reporting, including that of C. diff, is for the Centers for Disease Control and Prevention's National Healthcare Safety Network. So in 2024, $24 million went to support NHSN. Now that supports all the staff that work on it, that supports people who work in hospitals that contribute to it, that supports modernization of data. I don't know if many of you will believe this in a day that we're all sitting out on Zoom, but as recently as 2018 and 2019, there were states who were doing reporting of C. diff cases by filling out a form and faxing it to their state health department, which is kind of wild to think about. So I wanted to also give you a sense. So $24 million, I'm going to guess that most of us will never have $24 million in our lifetime. And sometimes that can make these numbers seem really enormous and scary, and we don't understand how they're spent. And I think that's why a lot of people, struggle to kind of, call their legislators and voice their opinion on the budget or on other things that have these huge price tags. But just to give you an example, so the National Healthcare Safety Net has 38,000 hospitals who use it. So that 24 million breaks out to be $631 a year per hospital that works with the NHSN. So think about that. For $631, that hospital is reporting its C. diff cases every year. That seems to me like a pretty reasonable price. Similarly, we're tracking almost 200,000 infections. So we're talking about $134 per infection tracked per year. And because of all of this, what we've been able to do is create antibiotic stewardship programs. We've been able to identify hospitals that have worse C. diff rates than others. We've been able to identify trends in C. diff transmission. Academics and doctors are able to go back and study all of this information. And that in turn has led to us being able to save tens of thousands of lives. And because we have reliable, actionable data. The last piece that I wanted to address up front is state and municipal funding. So I'm curious, and people could put this in the chat if they're interested. I'm curious what states people are from that are on the call. I mean, I know some of you, but if you want to put it in the chat what state you're filing in from, that would be great. But frankly, most states and municipalities, including my great state of New York and my city of New York, they raise very little tax and spend very little money on their public health infrastructure, including infectious disease. It mostly comes from the federal government. So through the CDC, federal funding is put towards each state, and each state gets breakouts. So to give you a specific example, and this 15.7 billion is the 2024 number. So of that amount of money, which again, $15 billion, should we all live to see that much money in our lives? I would just cure C. diff myself. But 4.7 billion of that is just funding for childhood vaccinations. So making sure that every kid can get those initial vaccinations that they need. I know vaccinations have been subject to some controversy recently, but I think we're better off without kids having measles and rubella and polio. 371 million goes to immunization and respiratory diseases. So this is tracking, studying, intervening for people with pneumonia, whooping cough, COVID. I mean, anything that's sort of immunization or respiratory related. And then 216 million goes to the states for emerging and zoonotic diseases. Now, zoonotic is a big word. But basically, a zoonotic means something that is transferred from the animal kingdom into humans. So there's a lot of belief that COVID is a zoonotic disease. HIV, most scientists who study it believe that it went from being in apes, there was simian immunodeficiency virus, and that in certain cultures, they eat the meat of apes, and that's how people were first exposed to it. And then it sort of lay dormant, and then eventually it mutated to what we now today have as human immunodeficiency virus. So studying things when they first happened, just stay back for a second. So studying things when they first happen, or when we first notice something happening, and I'll give you an example that's recent and hopefully many of you have heard about, which is Mpox. So it used to be called monkeypox. We say Mpox now. And so there was an outbreak of Mpox, I believe in 2022 in New York. And that was particularly dangerous for people like myself who are too young to have gotten, because I'm very, very young, very young. I'm actually I'm like just like 2 years. If I was 2 years older, I would have gotten the smallpox vaccine, but I didn't get it because smallpox had been eradicated. And the smallpox vaccine does work for Mpox. But we were able, because of this network, and particularly in New York, we were able to sort of identify and start following these cases and identifying people who had contact with people and study the disease very rapidly. And so we were able to contain it and get people vaccinated and basically arrest this outbreak. Unfortunately, in certain African countries, they don't have the infrastructure that we have, and they have had multiple recurring outbreaks of Mpox in their countries. So those are the kind of things, these are the kind of things that could potentially be cut between HR1, which Kevin will talk about in a second, and also the 2026 federal spending budget. So thank you for joining us, Kevin.
Sorry for being late.
Because I was just about ready to hand it off to you to talk about what's at stake in the big beautiful bill and the FY26 spending thing. So Jamie, you want to go to the next slide?
Got it. Well, thank you all. It's really a pleasure and an honor to be on tonight's webinar. And I apologize for being a few minutes late, but I slid in just in time for my slides, which is great. So we wanted to just walk through sort of two parallel tracks that are happening right now in Congress that have some significant bearing on some of the organizational priorities. And so the first track we're going to talk about is what you've been hearing perhaps in the media, social media, about, President Trump has called this one big beautiful bill, and it's House Resolution 1, which is the HR number. There's bills that I think we're up until about Bill HR 6000 and something, I think. So the leadership in Congress determines priorities, and one of those is by giving bills numbers, and so this denotes I think how important this is for the Republican majority in the Congress, as well as for President Trump, which is why it has that number. So the bill that's being debated actually as we speak, as I was cooking dinner real quick, which is why I was late and lost track of time and was following the floor debate on CNN and other outlets. The final version that they're voting on tonight will more likely than not, and this is according to the Congressional Budget Office, the CBO, which is the nonpartisan scorekeeper. Usually the party in power, when they're advancing something large like this through a budget reconciliation mechanism, they hate the CBO. So if the Republicans are trying to do something, they hate the CBO score. If the Democrats are trying to do something, they hate the CBO score. It's kind of a universal dislike of the sometimes the financial truth tellers. So they have to analyze all of these big pieces of legislation to have some sense of what the impact will be on the budget, the federal budget, what it'll be on taxes, and what it could be on some of the program delivery components. So the individual effects here, the most significant that we as an organization are focused on and care about, is that about 12 million Americans over the 10-year budgetary window of this bill would likely lose their health insurance coverage. And why would that happen? It would be mostly through reductions and a tightening of eligibility and paperwork requirements for Medicaid that will likely result in people leaving the program or not getting in the program. And then there's smaller amounts of funding that impact the state children's health insurance program, which was started about 20 years ago. Some people just call it CHIP, state CHIP programs. And then the Affordable Care Act, they're going to scale back some of the subsidies that lower income Americans are able to access in order to pay for insurance coverage through the marketplaces or exchange that many states offer, or you can go to the federally managed exchange and you can compare policies that have different, some are platinum, some are gold, some are silver, and those denote certain deductible levels and certain copays and then certain services that would be covered under those plans. So some number of people are very likely to not receive those subsidies going forward, and as a result, they'll have to drop their coverage, or they're likely expected to drop their coverage for affordability reasons. One other side effect, and this isn't from CBO, this is just from what you're hearing from a lot of folks, Republicans and Democrats, is that by increasing the number of people who are uninsured, you're going to increase the number of people who seek care in a hospital emergency room, for example. Folks who are in dire straits will not get the preventative care they need. They'll end up in emergency situations, or even not emergency situations, but seeking care, because by law you can't turn someone away when they shows up at the door of your hospital. So I think hospitals will find more strain from this and having to handle more folks who are coming in without having any financial ability to pay for their care. Some of the other system components as we think this through it's about $1.1 trillion in funding that'll be reduced over that 10-year budget window. Most of that is going to be in Medicaid. Sorry, I think the numbers I maybe screwed these up. There's 1.1 trillion is going to be in Medicaid reductions in funding for the Medicaid program that the states administer. And about the 0.1 of the trillion is going to be for the CHIP program and the ACA. Going back to the uncompensated care piece, this is going to be particularly hard, people anticipate, for rural hospitals, smaller ones who operate with a very thin margin. So losing those paid customers, if you will, coming into the hospital for care, having more people who need uncompensated care. There's a fear that a lot of those hospitals in rural areas are going to lose. So folks will have to travel even greater distances to get care. They have set up over the weekend, in response to some concerns from Senate Republicans, they've set up a hospital stabilization fund, but it's not a lot of money relative to the cuts in the bill. And so the idea was that they'd set this aside so that they can help hospitals and plug certain holes when they have them. But it's going to be about, I think it's $25 billion was the number I saw. So it's not a lot of money when you're thinking about you're going to cut, 1.1 trillion. But I think that's designed to give some folks some comfort and reassurance that those hospitals might be protected. But it certainly won't do anything to help people get their coverage back. This is, without question, the largest single cut in the entire history of the Medicaid program, which was started in 1965. So this is really kind of seismic. And then lastly, the Congressional Budget Office says that this is going to result in a $3.3 trillion increase in the U.S. debt. what they've tried to do, and we didn't want to get into this tonight, there are ways that they're trying to, I mean, these are the ways they're trying to raise revenue by reducing the amount of funding that they are sending out to the states federally. This is in order to pay for, a lot of tax cuts, which is mostly what that is. Most of this are going to be to extend the tax cuts that President Trump passed in his first term. But if you go through the fine print of the bill, there's lots of other tax cuts there. So they're trying to balance things out between, spending reductions and tax reductions, meaning fewer dollars in the U.S. Treasury. And so they're trying to do that, but they are unsuccessful because the CBO says this is going to be a $3.3 trillion deficit. So I know a lot of folks are uncomfortable with that. Some very conservative Republicans in the House and Senate in particular have been threatening to withhold support for the bill, based on the fact that it's not budget neutral, but it will increase our deficit significantly. Okay, we can go to the next slide. Okay, so this is what's happening now, and I'm going to get into the final slide, what all this means contextually as far as where Congress is moving on these two different fronts, so you have a sense of that. But the other thing that we're tracking and are concerned with and are seeking your support to help influence Congress to change the trajectory of where we're going. We are not happy with the Medicaid cuts. We're very concerned about how it's going to impact a lot of folks in our community, and we'd like to see that addressed. But in addition to that, as part of the annual budget process, right? The reconciliation process is one that goes over a 10-year period and adjusts major levers within the government. It adjusts taxes, over a 10-year period. It adjusts entitlement spending. But then there's the day-to-day operations of every department in the government: the Department of Defense, the Department of Interior to manage our, national parks, the Department of, Housing and Urban Development, which is focused on affordable housing and things related to that. And then there's also the Department of Health and Human Services. So within the Department of Health and Human Services, there are several agencies that we care deeply about, right? We want to see more biomedical research funding so we have improved treatments and a cure. We want to have adequate funding, as Christian was talking about, for public health activities so we know where there's an outbreak, who is experiencing the outbreak, and then thinking about some of the things that might be common among some of the patients. What are the risk factors? Maybe some folks are going to be helped by treatments versus others. That base of data and science is incredibly important to try to prevent and better manage these outbreaks. And then lastly, when you start talking about the NIH and the National Institutes of Health and trying to secure funding for biomedical research so that we can see innovation in the space and better treatments and a cure, well, the Food and Drug Administration is the agency then that takes the data from those clinical trials and determines whether or not a drug is safe and effective, right? So it takes really specialized and important research and scientific staff who can read that data and understand and protect the public health. So I'm going to bounce around a little bit based on how I presented this. I'm going to go to the middle first for the National Institutes of Health. So the National Institutes of Health, I would argue, has been one of the most bipartisan agencies in the entire history of the United States government. There have been many Republicans who get to take significant credit for helping to grow funding for this incredibly important institution. Senator Arlen Specter, who at the time was a Republican from Pennsylvania, Roy Blunt, who's a Republican from Missouri, both of them played key roles in efforts to double the NIH funding over the course of several years. They recognized that this put the United States in an absolute top-tier leadership position in the entire world. No one has the biomedical research enterprise that we have. It is the envy of the world, and it is helping to accelerate, treatments and cures for Alzheimer's and for a host of autoimmune diseases. We've seen tremendous progress because of this work, and I think it's a source of great pride. The beginning of this administration, they went in to many agencies. Elon Musk had his crew of folks going in and looking things over. They moved pretty quickly, and you'll see here their numbers underneath each of these bullets. At the NIH, we've lost 1,200 researchers, scientists, and staff. And we've had a freeze on a lot of grants that have been going out to, the University of Michigan or Stanford or Indiana. These aren't just blue state, Harvard gets a lot of press, but these are, land grant colleges all over the country who are doing incredible work. We have attracted some of the best and brightest people, not just in the United States, but around the world. I had the privilege recently of talking to a friend of mine who's from Argentina and runs a really dynamic program at the University of Colorado. And he described for me 25 years ago when he and his wife both got their PhDs in Argentina, they applied to come to the United States because of this bountiful funding that we have. And so, he was concerned about a reverse brain drain where people who are here now decide to go to China or other places because there's a lack of opportunity here. And further, and probably the most disturbing to me, I was with a foreign CEO of a medical device company, and he said, if we continue on this trajectory, we'll find out eventually down the road that the cure for Alzheimer's disease will be discovered in China. So I think there's some really seismic and deeply concerning things that are happening with the budget that we're going to be asking for your help on. So on top of the terminations that have taken place in the first quarter of this year, the president's budget proposes to reduce funding for NIH by 40%. So it would drop it from $47 billion to $27.5 billion. There's currently 27 institutes and centers at the NIH. It would eliminate many of them and actually shrink them down to 9. This says 19, but it's 9. For CDC, jumping there. So you get a lot of this knowledge and science, which is incredible. It helps inform how doctors treat, conditions like C. diff. It leads to improved treatments and eventually cures. All this stuff is amazing. But that base of science is what our friends at CDC take and help to, do the wonderful things that they do around data collection and also making sure that clinicians understand across the country what is the proper protocol to treat C. diff. What are the things you should be doing? They get that information out, in many times in real time. So it's super important. The DOGE cuts affected them deeply, and they lost 2,400 CDC staff, which is significant. They're proposing, as far as this year's budget or next year's budget, to reduce overall funding again by another 44%. So it would take them down to $5.2 billion. And it would severely restrict and handicap their ability to do a lot of the really important functions. I mean, I shudder to think what will happen if CDC is not fully and capable if we have another unrelated pandemic or anything around those things. And then lastly, we get the biomedical research, we get the public health activities. The private sector is taking some of this basic science that's being generated by NIH, and they're taking that knowledge and turning that into treatments and cures, which is so incredibly important. The folks at the FDA, if you've ever had the pleasure of spending any time with them, they're an amazing set of public servants. They could probably get paid 3 or 4 times what they make if they went to Pfizer or some other biopharmaceutical company, but they instead are largely, a lot of the drug reviewers are up in Rockville, Maryland. And so when those companies develop new products, they have to do clinical trials, right? Many of those trials can take years, take up to 12 years to do a full phase clinical trial. They gather all that data, they look at that data, they kick the tires on the drug, and they make sure that whatever they approve, is safe and effective. You may remember the FDA was started by another wonderful Republican president named Teddy Roosevelt after Upton Sinclair's The Jungle, and realized that there was a need to have a Pure Food and Drug and Cosmetic Act, so we could protect Americans from some of the snake oil that was, out there, all these cures and things that could harm people. And there was no group of, dedicated public servants and scientists who could help, sort out what was wrong, what was true, and what was not, and what could cause harm. So they've since lost 1,900 staff. It's their cut isn't quite as big. It's 5.5, but it's significant. And we've lost a lot of senior staff of late. Peter Marks, who Christian and others know well, has been very involved in the vaccine program up there, and he left and was pushed out, which is a real sad thing, a real loss to the country, in my opinion. And then lastly, one of the other agencies that's maybe not a... Sorry, was there a question? Oh, okay. So the Biomedical Advanced Research and Development Authority, BARDA, which was, you all may remember years ago, there was an anthrax attack after 9/11 that hit the United States Senate. And I think the government realized that we were kind of woefully unprepared for a foreign adversary trying to take advantage of us by poisoning us with anthrax or, some other type of vector. And so they created BARDA. And so BARDA looks at a lot of infectious diseases that can be weaponized. And so they would, under this budget, propose to eliminate BARDA and then fold it into a new HHS office. So it would be a much less robust um, 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 agency under the president's plan. So I know this sounds a bit doom and gloom, and I'm not trying to uh, well, I am trying a little bit. I mean, these are the facts, and so I just want folks to understand kind of what we're looking at here and tie it back to, again, the mission of the Peggy Lillis Foundation and what we're trying to do to improve lives. Um, Before I go into the next slide, maybe just take a pause and see if there's any questions from folks. Okay, let me move to the final slide that I have here. If we could move to the next slide. Okay, there we go. So as I said, so these are two separate, tracked issues, right? One of them is the big beautiful bill we just talked about, which is being debated right now in the United States Senate. So the Senate has a wonderful, this is a unique procedure that they only use once or twice a year. And you may have remembered from your high school civics class, the Senate filibuster. There's 100 members of the Senate. Everything has to be done by having 60 votes. So you need to get a majority every time. Somebody can always object and require that. So in order to avoid that 60 vote threshold or the filibuster, there are certain rules that govern what's called a budget reconciliation process. And so there's an office within the Senate parliamentarian, who looks at every single line in this huge bill and determines whether or not they meet the rules. So a bunch of things that were in the legislation have been pulled out because the parliamentarians said that they're not able to proceed with those bills. So I only say that because there hasn't been a final text yet. Every time the parliamentarian rules, they make a change to the bill and then they have to reconsider it. So tonight, they're engaged in this process called what they call votorama, because we have to have cute, cheeky terms for things. But it simply means that any member of the Senate can offer an amendment and debate it on the floor and have a vote on it. And so this process will basically go on all night. Usually they've got cots and anterooms off the Senate floor, but it'll go until they just can't go anymore. So I suspect that sometime early tomorrow morning they will have wrapped up the bill, or maybe you all will be drinking your coffee when they pass it. But that'll probably be as long as they can stand. I don't think they have the votes quite wrapped up yet, so we'll see. They can only afford to lose 3 Republican senators because every single Democratic senator is going to vote no. They've said it in advance. So I assume that this is going to pass the Senate. It's possible that it doesn't. It's going to eventually pass. It might mean they have to make some changes to accommodate somebody's objections, or they might have to they may try to cut a side deal. I know that Senator Murkowski from Alaska was concerned about elements of the bill, and they added some things that were specific to Alaska to make it more palatable for her. So they could certainly always do those things if the majority wants to. But I think at the end of the day, this is going to pass. If it passes, it's going to go to the House, and the House will take it up. They'll have to likely, under the pressure from the president, take the bill as written and pass it. If they make any changes to the bill, what the Senate did, they're going to have to ping pong back and forth, which will delay it. And the president has set July 4th as his deadline, that he wants the bill on his desk. This is my other favorite term is the Senate is essentially jamming the House. They're saying, we know that you don't have time. We know that you're not going to want to do it. So you're going to have to take whatever we give you. And at the end of the day, we're going to jam it because the president's going to go after you and say, look, you're going to do this. And that's what's going to happen. And in general, this year, when he asked the majority in the Congress to do it, they do it. So I suspect if it's not going to be by the July 4th deadline, it is going to be sometime in July that they're going to pass something along these lines. I know they're hearing from a lot of folks, you among them, hopefully, and trying to just get them to at least be conscious of the fact of how this is going to impact their constituents. And then finally, the budget process that I talked about with NIH, CDC, and FDA. That's a process where at the beginning of the year, the president submits a budget proposal to Congress. The Congress looks that over. If the Republicans control the White House and the Democrats control Congress, they'll say it's dead on arrival. Vice versa, if the Democratic is president and it's a Republican Congress, but that bill is a recommendation. Under the Constitution, only Congress has the ability to appropriate and write the laws that govern spending. So they take that recommendation and they decide on their own what they want to do. So while what I laid out for you in that previous slide has all of these projections of what the administration wants, that doesn't have to be the final story. That doesn't have to be the final budget bill that they do. So again, hearing from you guys is really important. They're going to start putting together, the House and Senate, their two bills that fund the Department of Health and Human Services in July. One or both bodies may actually pass them out of their committee. These have to be passed by September 30th, which is the end of the fiscal year. It's possible in the fall they have to do what's called a continuing resolution because they need to buy more time, and they don't want the government to shut down. But again, we're at a critical moment, both with the big, beautiful bill and the appropriations process, for you all to be engaged and communicating to your senators and representatives how you feel about these really important and consequential issues. And with that, I am finished with my slides.
Thank you, Kevin. So before we get to the call to action, if folks have questions about any of this, please, you can put them in the chat. You can take yourself off mute and ask it. We do want to make sure that folks understand this. We because of the makeup of the government, much of this is being proposed by Republicans, but we are not a partisan organization. We're not weighing in on things that are outside of C. diff. I think Kevin did a good job of speaking to, the concern, the incredibly important role that Republicans have played in building out our health public infrastructure. For those of you who may be following this, Senator Tom Tillis, from what I call my state-in-law, because my husband's from there, North Carolina.
Bring a note for your mother.
He's has been opposing this bill because of the cuts to Medicaid and how that will impact his state, among some other concerns. So, this isn't a partisan issue. It's an issue about, are we going to get what we need? Will we have the funding we need for drug development? Will we have it for tracking surveillance? Will we have it for people's health care? So if folks have questions, please let me know. We're happy to take them. I also realize it was a lot of information, another reason why we recorded it. All right, so doesn't seem like it. I also realize it's towards the end of the day. So let's go to the next slide, please. So you don't have to write this down. We're going to send a follow-up email. But basically what we're asking is for you to call your legislators. Either later this evening or early tomorrow, you'll get an email from us, similar to how you got this invitation. And basically, if you agree with what we presented, we want you to tell your congressperson and your senator's offices that you oppose the cuts to Medicaid and the funding reductions for NIH, CDC, and other public health agencies in the 2026 proposed budget. If the call goes to voicemail, you can leave a brief message with your first name, your zip code, and then state your opposition. And this doesn't have to be a long and arduous thing. My congresspeople and senators are probably sick of hearing from me because I call them all the time. And I've always called them all the time, regardless of who's running things. And so it could be something as simple as, hi, my name is Christian. I live in Brooklyn. My zip code is 11218. I'm calling to express my opposition to the cuts to Medicaid in the big, beautiful bill and the proposed federal public health funding cuts in the president's 2026 budget. As a survivor of C. diff, in my case, I would say as the son of someone who died from C. diff, cuts to agencies like NIH, CDC, and the FDA threaten the innovation for C. diff and antibiotics infections. which will harm and kill hundreds of thousands of Americans every year. I ask that you vote against these cuts. Thank you. That's all you have to do. Obviously, you can make it sound more like you can add your specific context, but when you're leaving a voicemail, or even if you talk to somebody, it's pretty simple to just, you know, say these words. You can practice it a few times. I sometimes do that if I have to give a presentation. And the Capitol switchboard number is there. We will also send that to you. You can also just Google your congressmen and senators and find out their phone numbers. Sometimes it's easier to call not the Capitol switchboard, but their state office or their office near you. Sometimes it's easier to get through to the staff there since everybody calls the main DC office. But that's really our ask for you. I've been doing this for 15 years now. My mom was gone 15 years in April. And so PLF was founded 15 years ago this month. And, you know, we fought to get increases to all of these programs because we thought they were very important. And so to see these potential cuts is devastating. And I think that they will have a devastating effect on people, whether that's because they can't afford treatment or because we stop innovating. I Earlier in the presentation, I showed you some examples of funding from BARDA, which Kevin then spoke about, that went to companies that are currently developing new treatments for C. diff. There's a very good chance that if these funding cuts go through, that there will not be additional funding for those companies and that those drugs will stop being developed. So right now we have fidaxomicin, we have vancomycin, which is not even considered the first line treatment, and then we have our two live biotherapeutic products, VOWST and Rebiota. I think we need a lot more. I think many of you are on this call went through multiple recurrences or have family members that do or treat people who do. And we need many, many more tools in the toolbox for the C. diff community. So that's our big opposition to this stuff. It has nothing to do with politics. It has everything to do with wanting people to not get C. diff to begin with, and if they get C. diff to have the best possible outcomes. So again, if there's any questions, feel free to ask them, but that's really all we have for you. And you will definitely get an email from us probably tomorrow morning at this rate, reiterating all of this and giving you the talking points. I also, by the way, I was talking about state funding when Kevin talked about the cuts to CDC. I mean, that's such a significant cut that it makes me think that then the pass-through money that goes to states will likely be very cut. And I just posted a few examples in the chat and also the link to the report that shows how much our state public health departments are reliant on federal funding. So if that's cut at the federal level, then the choices will be to not have public health in your state. So no smoking cessation programs, no anti-obesity programs, or to increase taxes at the state level. So we're probably going to pay for it one way or the other. So anybody have questions, comments?
Yes, Audrey?
Oh, hey, Audrey.
Yes. Okay. So here's the issue. I know, and this is probably true of you as well, that both my senators and my congressmen, they're Democrats and they're committed to voting against this bill. So it's pointless for me to contact them. The idea would be to contact those few senators who are on the fence, right? But you can't do it. In other words, if you attempt to go through the House or the Senate operator to get to some other member of Congress's office, you can't. I tried doing this last year. I can't remember what the occasion was, but I was trying to get through to some other senator. Oh, I know what it was. It was a senator in the state of Texas. Okay, never mind. It was a completely different issue. But the point is,
Audrey, actually, can I respond real quick to that?
yeah.
So I hear exactly what you're saying, right? You're preaching to the choir. So the sense is, why do they need to hear from me? I think it's really important that they hear from us, whether they're opposed to this or they're in support of it, because they're going to want to know that when they were, up there doing their thing, we were, behind them. And I think it's an important opportunity to build awareness about the Peggy Lillis Foundation and C. diff. And you can say, I understand that Senator so-and-so has been very public about his opposition to this. I'm just calling on behalf of the Peggy Lillis Foundation. We care deeply about the Medicaid program. We care deeply about, funding for NIH. And we're grateful. I just want to let you know you're grateful for your support. I worked on the Hill for about 11 years, and you always hear from people who are pissed off at you. You hear less from people who just want to say thank you. And I think it's really important that they hear that from us. So I know we're trying to move people, but I would just, let you know that there's value in that call to that person that's already committed to what we want them to do.
All right, but that's not going to change the vote. And that's what we're talking about. We actually want to change a vote.
We do, but I think this is an opportunity to, continue to build relationships and awareness with important members of Congress on all of our issues that, we're working on. So it's hard though when you're not. I mean, if you have friends and family that live in a red district or a red state, that person's on the fence, ask them if they'll do it, because you're right, there is no way around that. They only have so many resources, and they're not likely to take calls from people that are not from their state or their congressional district.
So what I would suggest is come up with a short list of members of Congress who are on the fence, and provide us with a list of their district home numbers. Their district home numbers might be available publicly, and we'll call them up.
So two things. So the reality of it is like people ask us this all the time, but calling a senator or congressperson whose district you don't live in has no effect. They don't care. They don't represent you. If you maybe owned $1 billion company and had feelings, they might be open to listening to them. But if you can't vote for them, they don't care. And frankly, they're not supposed to. Like, even in New York, like, I'm very frustrated with Hakeem Jeffries right now. He could care less what I think. I don't live in his district. But what I do want to say is, we had people and still have some folks on the call who are from Arizona, Kentucky, Idaho, Montana, Utah. These are all red states. These are all states where there might be some wobbly politicians or senators. And so they can make a difference. And in addition to those of you who joined the call tonight, we're going to be sending a recording of this video and also the request to everybody on our mailing list. So it's not just you. And I think what Kevin's saying is true. I mean, assuming you have a good relationship with your family or friends who live in a red state, you could forward that email to them and say, hey, like, I know my senators are going to vote against this, but do you think you could reach out to yours? And here's why I care about it. And just briefly say why. I think I mentioned earlier that North Carolina is my state-in-law, so I will be forwarding this to my brother-in-law and my sister-in-law and asking them to call, their senators in North Carolina. So, there are, as Kevin said, a few who are, Tom Tillis is against it. There might be one or two more who have spoken out against it. So you really only need 7. But also, as Kevin said, there's a lot of pressure. But if we can't stop it, maybe we can minimize the damage. It's not necessarily black and white. And also, if you do live in a state like Myra, not to call you out, but I know that you're from Washington State, and I know that your Senator Patty Murray has been very outspoken against her issues with these bills. And I think giving her a call and thanking her for that is not a bad idea. Because again, AOC said this, and I don't know if people, she's a controversial figure, but AOC said that when she first came into Congress, all she did was hear from people who were mad at her. And it took forever for her to get calls from people who were like, thank you for what you do. And I think that's the case. I think what Kevin said is right. People call when they're angry, not when they're pleased. And so I think we need to do better of carrots as well as sticks, because at a certain point, it's hard to keep going if you don't feel like at least your constituents have your back. So I think both are important, but I also totally recognize your frustration. Abolish the Senate. No. Listen, they used to get appointed by the legislators of the state, so we've come some distance. Anybody else have anything? All right. Well, thank everybody for joining. We really do appreciate it. Please make those phone calls tomorrow. Please do share with your friends, your family. We'll have social media graphics as well that you can post on Instagram. And definitely, if you can call, because phone calls are taken much more seriously than an email, much more seriously. So again, thank you so much. Thank you, Kevin, for taking time out of your night to join us and do this with us. And thanks, as always, to Aaron and Jamie, who are the wind beneath my wings. And thank you, everybody, for joining. If you have any questions, comments, concerns in the next couple of days, feel free to reach out to us. Thank you. Have a good night.
Bye, guys.